Graduates and guests, it's my honor to call on Boston Mayor Martin Walsh to give the keynote speech for this year's commencement.
Thank you, Dean, and good afternoon to everyone, faculty and staff, families and loved ones, and most of all, you, the graduates. It's a great honor for me to address you on this occasion, and I know that it's me, the diplomas, and a party somewhere, so I'll try and be brief. I'd like to offer special thanks to David Rosenblum, the chair of your Department of Health and Policy Management. Dr. Rosenblum served as my co-chair of public health on my administration's transition team. His work is helping guide the direction of our public health policy in taking in the city of Boston. It's another example of how Boston University's School of Public Health plays a leadership role in our city. As graduates, you have the opportunity to join this tradition and to become leaders as well. I'm going to talk a little bit today about why that's not your only opportunity, but it's the city's opportunity, and about why we need you to aim high and set ambitious goals. But I want to start by telling you some of my story. You may have heard I suffered from cancer as a child, and I recovered from alcoholism as a young adult. I want to tell you more about those experiences today. First, because these stories contain lessons about the values of public health, but also because my story is about doing more than you thought was possible with your life. I was born at St. Margaret's Hospital in Dorchester, which is now St. Mary's Women's and Infant Center. It does amazing work supporting vulnerable families. I grew up in Dorchester. My parents, as the Dean mentioned earlier, both immigrants from Ireland. They didn't have much of an education, but they had very strong accents. But that was okay in the neighborhood that I grew up in. We were a working class neighborhood in a community of immigrants. My dad was a union construction laborer. My mother was a homemaker. They raised myself and my brother Johnny in a 3-decker house that my mother still lives in on Taft Street. I went to St. Margaret's Grammar School, and at the age of 7, I was diagnosed with Burkitt's lymphoma, a fast-moving type of cancer that mostly affects young children. For a long while, people were wondering if I would make it. I had 4 years of chemotherapy, and I missed almost 2 years of school. But the community rallied around me. The community rallied around my family, neighbors, the church. They did, and they supported us. In hundreds of different ways, they let us know that we weren't going through this alone. But to survive, I needed more than a neighborhood. It took research, surgery, diagnosis, technology. It took caring doctors and nurses at Children's Hospital and the Dana-Farber Cancer Institute. And it took my family having access to those treatments. So by the age of 11, I was cancer-free, and my childhood was back on track to a normal life. I felt safe and secure in my neighborhood. I love sports, I love politics. I dreamed someday of being the mayor of the city of Boston. But I wasn't focused on school. Wasn't what I was focused on. The ambitious kids in the neighborhood went on to schools like BC High and CM, but I couldn't get in because I wasn't paying attention. After high school, I went to college. I went to Quincy Junior College to get my grades up because my grades weren't there. I enrolled in Suffolk University because I realized I could do this. It was easy, I could do it. I got good grades in college. But I went to Suffolk, and after the first semester I dropped out because I wasn't motivated to pursue my education. So my father helped get me into the building trades as a construction worker. After a while, I got a job in the benefit fund office. That office had a very important function, but I didn't like the work. I knew it wasn't what I wanted to do with my life. I didn't have much direction. I wasn't sure exactly where I was going. I was too busy partying and not focusing on what I want to do in the future. So I developed a drinking problem. I started drinking extremely heavy. And in the neighborhood that I came from, that was normal in some circumstances. But gradually things got worse. Soon I wasn't a reliable friend. I wasn't there for my parents. I wasn't able to function the way I wanted to. I lost myself inside. On April 23rd, 1995, my life somewhat crashed to a halt. Couldn't really function anymore, didn't know where I was going to go. I ended up going to detox. I felt like my life was over. What I didn't know was my life was just beginning. With the help of treatment professionals and recovery groups, I got sober. And more than that, I got active again in the same community that supported me as a child. A year and a half later, my name was on the ballot as a candidate for state representative in the neighborhood I grew up in. I was 30 years old, and I was finally following what my dream was in life. I won that election. I went to the State House. As the Dean spoke about earlier, I worked on many issues around recovery programs. I worked on public health issues. I worked on job creation, worked on immigrant rights, protecting workers' rights, funding early education. In 2013, Mayor Tom Menino announced after 20 years he would not run for mayor of the city of Boston. I had a chance to go after my second dream. Most of last year, I spent 7 days a week, 18 hours a day campaigning for mayor of the city of Boston. On November 6, 2013, I was elected mayor of the city of Boston. My inauguration was in January at Boston College at Conte Forum, an arena just like this one. I sat on stage, looked out at about 8,000 people, and I thought back on the path that took me there. It wasn't a smooth path. It wasn't a straight path. There were obstacles and surprises, twists and turns. It was filled with challenges. There were even times when I gave up hope. Any number of moments. If you had told somebody who knew me one day I would be the mayor of the city of Boston, they probably would have laughed. I might have laughed at certain moments. I'm proud how I persevered. But the truth is, the story is about strong communities, and it's a story about public health. Let me explain that. When I got cancer, my parents and teachers felt I faced it bravely. But really, I was just living day to day in my reality like any child. Looking back, the real resilience lay in them and in the community that they had built. We didn't have a lot of money, but we had a good, strong neighborhood, church, and my father had a good, strong union. My father had benefits from that union, and we lived close to great hospitals. And by the way, the commissioner of the health and hospital for the city of Boston at the time was a man named David Rosenblum. When I got sober, it was the same thing. Recovery stories in the media are often described as heroic journeys of individuals. But once again, it took a community. It was made up of very different types of people, all brought together by the crisis of addiction. It was counselors and health professionals, and it was men and women living in sobriety, people who had been where I had been, who had taught me to do what they had done. It was the recovery community. Recovery reaches beyond individual stories. It transforms every aspect of a person's life, including their relationships with families, with the workplace, with law, with the community. It's a deeply personal experience with a wide social impact. That's the realm of public health. Sometimes doctors don't understand this aspect of recovery that goes beyond the physical. As public health professionals, you will be uniquely positioned to bridge the gap between medical and the recovery community. And I ask you for help in doing so. People get sober not just by improving their health, but by learning how to live in their community. In recovery, when you feel vulnerable, you have to reach out for help. And the only way to make your sobriety stronger is to help other people achieve it. You have to think every day about how your actions are affecting others. And you have to live in service for those who are still suffering. That's why we sometimes say we've been given a special gift. We've been forced to learn the only way to help yourself is to serve others and strengthen community. Now that's true for everyone. It's especially true for public health professionals. You've chosen this kind of career, and you've had this kind of education that defines the success through service. Public health leaders have demonstrated this truth in amazing ways. I'll tell you about 3 people who've inspired me personally. The first, Dr. Paul Farmer. In 1987, at the age of 28, Dr. Farmer co-founded Partners in Health to provide life-saving treatment for TB and AIDS at a single facility in the country of Haiti. Since then, his work has spread all over the world, from Rwanda to Peru, achieving success rates equivalent to those in much richer companies. Reading about Dr. Farmer changed my views of what is possible in both public health and personal development. His success in public health is based in the sensitive and rigorous understanding of the communities he works with, and in practical commitment to doing what he will for them, rather than what looks good in a textbook. And his achievements owe not just to the work of ethics, but also to his relentless ability to collaborate with patients, with partners, with government, and with private funders. Cultural understandings and constant collaborations. These are the same values we apply to public work in the city of Boston. The second public health person that I like to talk that inspires me is Dr. Howard Koh. Dr. Koh sat where you sit right now 19 years ago. He earned a master's degree in public health from Boston University. In 1997, Massachusetts Governor William Weld appointed the Public Health Commissioner for the Commonwealth of Massachusetts, Howard Koh. In 2009, President Barack Obama appointed him Assistant Secretary for Health in the United States Department of Health and Human Services. That's a Republican governor and a Democratic president. A good example of how public health transcends politics. Dr. Koh has created successful programs to combat health disparities in HIV and AIDS, and to promote vaccinations and fitness and research. I know how effective he is because I saw it here in Boston. When I was a state representative, Dr. Koh went from city to city, from neighborhood to neighborhood, to advocate for a ban on smoking in bars and restaurants. Some people couldn't imagine a bar scene without a cloud of smoke. And restaurant owners, good people, came out in opposition of the ban, afraid it would hurt their businesses. Dr. Koh was kind, but he was firm. And he never stopped. He never let lose sight of the facts. And he never let us lose sight of the human cost borne by vulnerable workers who work in these establishments. His persistence paid off. He changed our culture. And he left a legacy in our city in the lives of countless workers we know would have contracted lung disease under the old circumstances. And of course, he left another legacy here. His son, my chief of staff, is Daniel Koh. Dan definitely takes after his father. He's a tireless advocate for positive change. The third public health professional who inspires me is seated right here among you. I don't know which one of you it'll be. I hope it'll be many of you. Being here today represents a tremendous personal achievement, and I want to congratulate you. You've mastered complex subjects and become an expert in your field. You've gained practical experience, often working with people of Boston. That sets your education apart. But in looking forward in your career, I urge you to think beyond the goals you've already set for yourself. Think about what Dr. Paul Farmer has done, what Howard Koh has done, starting in a similar place. I truly believe that, like them, you can use the tools of public health to change the world. I felt that power of change at a deep level. It saved my life twice. I have no doubt that you will do the same for many people. Some of you will travel far, like Dr. Farmer. The needs are great. The same cancer I survived in the 70s is killing thousands of African children every year, simply because they don't have access to chemotherapy. And some of you will become transformative policy advocates like Dr. Koh. And as new public health professionals, you have learned the powerful framework for understanding the needs of communities. As your experience grows, you must make your voices heard. And if you stay in Boston, you will help us break new ground on what public health can achieve. Maybe you will work in our new Office of Recovery Services as we fill the gaps of addiction treatment and tailor it to the needs of the vulnerable populations here in the city. Maybe you will help us use the tools of public health to end the cycle of violence, integrating trauma response into our public safety framework, or bringing trauma treatment to our community health centers. You will find in the City of Boston a willing partner in these dreams. We need you to help solve the greatest challenges that confront us. We need your energy, we need your expertise, and we need your leadership. So I look forward to working with you, and I look forward to being inspired by you. Because I know until we meet again, in a place where children develop resilience, where families grow strong, where addicts find recovery, where neighborhoods thrive, I want to thank you once again, and congratulations to the class of 2014.
I want to thank the mayor for his inspiring and personal remarks, and as I said to him as we were in the robing room, I hope this will be a continuation of his strong engagement with public health, both with the School of Public Health and with public health in the city of Boston. There are great needs there, great opportunities, and we're happy to be working with him as a partner going forward. I'd like to, as our appreciation, a commemorative clock, and present that to the mayor. I would also like to wish bid the mayor adieu because he needs to head off to other engagements, and my one word of advice is be sure to leave the academic regalia or you're going to look out of place at the next event. All right? Thanks, Mark. Thank you, sir.